Over a decision from the Biden administration to allow human fetal tissue for medical research. The Department of Health and Human Services is reversing a Trump-era policy banning the use of tissue from elective abortions. The National Right to Life Committee called that decision sickening. In a statement, Family Research Counsel Tony Perkins wrote that the decision means taxpayer dollars will be used for what he describes as barbaric experiments.
Here with us now for more is Melanie Israel, Research Associate at the Heritage Foundation. Melanie, welcome. Thank you for being with us this evening. So the decision essentially returns Obama-era guidelines. Melanie, why now?
This decision was not surprising. It was definitely disappointing, though. This is one of those policies that you can really see coming from a mile away from the Biden administration. We know that many researchers who have traditionally relied on fetal tissue for their research have been itching to have access to it again. They've been demanding to have it back ever since the Trump administration correctly tried to divert resources towards ethical research. And so it was a very unfortunate decision from the Biden administration, but again, not really all that surprising. They are taking orders from the abortion industry.
Melanie, good evening, and thanks for being here again. While conservatives and supporters of pro-life policies oppose the move, some scientists say the research it allows has helped to develop vaccines and treatments like for diseases like Parkinson's or HIV. I want to get your thoughts here.
I think we need to take a step back here. While fetal tissue research is nothing new and it's been around for a very long time, it's very misleading to say that fetal tissue is the reason that we have things like the polio vaccine, because that's not true. In fact, and it is those ethically derived sources like discarded surgical tissue, adult stem cells, those are what is actually contributing to successful treatments for a wide variety of conditions and ailments, not tissue obtained from elective abortions. And so we don't have to choose between one or the other. We can have good science, we can have rigorous research, but we can do it in an ethical way.
Melanie, along those same lines, the FDA will now allow abortion pills to be shipped through the mail during the pandemic for public safety. The move reversing a Trump administration policy backed up by the Supreme Court. Do you believe the Biden White House will try to extend this policy once we get past the pandemic? And it seems like we're getting pretty close.
Right. I think this is an example of the abortion lobby finding a crisis and not letting it go to waste. This is really meant to try to lay the groundwork so that they can do away once and for all with that requirement that these dangerous pills be dispensed in person. That's been one of the many restrictions on dangerous abortion pills for over 20 years, the entire time these pills have been approved on the U.S. market. And the abortion lobby ultimately wants abortion pills to be available over the counter anywhere for anyone to be able to have access to at any time. And so this excuse to make abortion pills available through telemedicine, abortion pills by mail, it's really just one step as part of a larger process to do away with all of the current restrictions.
All right, Melanie, we have to leave it there, but thank you so much. Melanie Israel with the Heritage Foundation. Have a great evening.